Professor, how important is a financially robust and supported World Health Organisation from the perspective of Australians wanting to see this disease eliminated ultimately?
I think it's absolutely crucial. The World Health Organisation has had a checkered history in some issues in the past and was criticised early on in relation to its closeness perhaps with China and its reluctance to call this a pandemic when it clearly was. We were well ahead of the curve there in making that term. But the World Health Organisation is a crucial part of the United Nations and the global response to this pandemic should and it should continue to be part of the mission of WHO. They can't do that work, particularly in low and middle income countries who are likely to be more severely affected than any country so far without funding. And so they definitely need the funding that they need to do. They need to be accountable for those funds, of course. But I'm a supporter of the World Health Organisation and their continued work in this and many other things.
Prime Minister said the 1.5 metre guideline could be here until the vaccine is found. Is the health advice that there basically be no large groups gathering until a vaccine is developed? Could the advice be that some states or territories, like say the Northern Territory, allow large groups to start assembling before a vaccine is developed?
So vaccine development, it's going ahead. We know of at least 60 potential vaccines that are in certain, mostly very early phases of development, but several of those are going to what's called phase 1 clinical trials, so are starting to be used in humans. So that's a very encouraging development. However, vaccines will take a long time to produce in the quantities that we need to give full protection to us, and indeed there is still some concern about whether that's even a possible goal in terms of a very effective vaccine at a population level. So we're looking to that in the future, and we're very hopeful, of course. In the meantime, we've got these public health measures in place. We will decide certainly give the advice to government to decide about how those measures should be used, for how long and which ones and to what extent, on the basis of our local epidemiology here, with one eye to the rest of the world, because our borders are an important component of our control strategy, and if there is still virus circulating in other parts of the world, then our borders continue to be a very important component of our control. But let's see how the next 4 weeks go. Let's concentrate on getting those key components of our public health response in place, and then we'll see what we can do in relation to the social distancing. Thank you.